What are some of the most common symptoms men experience when their testosterone levels are low?
So when men come in here, they're usually concerned about low libido, low energy, loss of muscle mass, the inability to maintain and put on muscle mass, extra storage of body fat, and again, they have a harder time to lose that body fat. So it's pretty much common throughout the majority of the men that come in here, the same relative signs and symptoms of low T.
So how does testosterone therapy actually work? What's the benefit of that?
So when the men come in here, we'll get through their signs and symptoms, how are they feeling, what their expectations are. Then we go for the clinical necessity to make sure we get the lab levels for their testosterone. Once we get through that process and we do the at-home treatments.
So how does testosterone therapy actually work or benefit to somebody should expect to see?
So how it works is you'll actually do home injections of testosterone cypionate is typically what we use here. You'll inject at home, either IM or sub-Q, and within the first month, you'll start to feel the benefits of that. A little bit more increase in the quality of sleep, the ability to put on and maintain muscle mass and burning body fat. Brain fog will start to decrease. So yes, it is safe. So again, when you come in here and we go through your signs and symptoms, make sure we have clinical necessity to put someone on testosterone replacement therapy with our in-house lab here. We'll get you all your results, put you through the process, and we do maintain patient contact throughout the course of treatment, whether it's after the first month evaluation with another repeat blood draw or every 4 to 6 weeks. So we're making sure we're maintaining the results you want as well as operating.
So how do I know if I'm on testosterone and it's working or not?
You'll start to notice it within the first couple of weeks, depending on where your level started at. Again, you'll start to notice that you're having some decrease in body fat levels. You'll have decrease in strength. The lean muscle mass will start to come on after the first month or two, depending on what your goals are in the gym or exercise. So it usually takes anywhere from 30 days to 6 weeks before you really start to feel the initial benefits. If you think it's not working for you, then you would call back in here. We would bring you in, do another evaluation with you, attempt to go through your signs and symptoms again. After 30 days, we do get your blood work, so we will show the changes in that, whether it's your testosterone, your estrogen. We'll review diet plans with you, as well as what your exercise and fitness levels and what your goals are, and then we can readdress it.
Tell me the myth of testosterone.
The myth of testosterone there's a lot. So when we look at the biggest one is, well, if I stop taking it, I'm going to be dependent on it for the rest of my life. So when we look at testosterone levels and what your body can produce, when you do have medical necessity, meaning that you have signs and symptoms as well as clinically low testosterone, if you do go off of it and you're staying within your therapeutic doses for medical necessity, yes, your body can go back to just producing what you already can naturally do. The only thing we got to be concerned about is when you take more than what's required medically, then yes, that can have a negative impact on long-term production.